concern. Tonight, Dr. Janae Khaldun is sharing what she's personally seeing as a doctor in the ER, and it isn't good. We've steadily watched numbers climb day by day over the past month.
And it has our state's top medical executive worried as cases continue to go up. Paula Tutman talked one-on-one with Dr. J about what lies ahead and what people should and shouldn't do once they're fully vaccinated.
I talked to Dr. Janae Khaldun after her stint working in the emergency room at Henry Ford Hospital downtown. She basically says that if COVID-19 and the vaccinations were a race right now, the virus is winning the race. She says, but there is a way that we can all get ahead of the virus.
Michigan's top doc reports that more than 2.5 million Michiganders have received at least one dose of the Pfizer or Moderna mRNA vaccines, and Johnson & Johnson's one dose is just entering the state.
These vaccines, they're safe, they're effective, they will prevent you from dying if you do come in contact with the virus. They prevent you from getting severely ill and needing to stay in the hospital. And even if you do get COVID, even after you've had the vaccine, and that's still a small possibility, even if you do get COVID, the chances of you getting very sick from COVID are very, very low.
And once you are inoculated, which means the vaccine has had its full ability to ward off disease, life can start feeling a little more normal.
The CDC has actually recommended that people who are fully vaccinated can actually gather within a home without masks on if other people in that home are also fully vaccinated, which is really, really important. You do, though, still have to be careful. Wear your mask when you're out in larger public spaces, when you're in gatherings, of course, if you're going to be indoors with people.
And that's because there's still not enough known about whether or not those who are fully inoculated can still spread the disease to those who are not, which means those who are inoculated still have a responsibility to others who may not be. Those who have gotten the shots are being studied, and the data will inform more safety protocols in the future.
As we get more data and understand more about whether someone who's been vaccinated, even if they don't have symptoms, if they can transmit it to someone else. But for now, keep wearing that mask, even if you've been fully vaccinated, and especially if you are in a large group out in public where you'll be around other people within 6 feet.
And so the key for the vaccine to get ahead of the virus is for people to not just think of themselves, but think of others. That means getting the vaccination when it is your turn, and also still wearing that mask in public places. Paula Tutman, Local 4.